What are the risk factors for recurring running injuries? Imagine lacing up your running shoes, feeling ready to hit your favorite trail or track. But then, an old injury flares up again, making you wonder why it keeps coming back. Recurring injuries can be frustrating, but understanding what causes them can help you stay healthy and keep running strong. One of the biggest factors is having a history of injury. If you have previously strained your hamstring, sprained your ankle, or had stress fractures, those areas might not have fully healed. Sometimes tissues don't regain their full strength or flexibility, which makes them more prone to re-injury. For example, if you had a stress fracture in your shin and didn't address underlying issues like bone density or energy intake, it's more likely to happen again. Training habits also play a big role. Running too much too soon, or increasing your mileage or speed suddenly, can overload your body. Overuse injuries happen when your tissues don't get enough time to recover. For instance, jumping from 5 miles a week to 15 without proper buildup can cause stress fractures or tendinitis. Using worn-out shoes or changing your running surface abruptly can also add extra stress and lead to recurring injuries. Your body's biomechanics and structure matter too. If you have muscle imbalances, such as weak calves or tight hip flexors, your joints and tendons may take more strain. Abnormal foot mechanics, like flat feet or high arches, can cause uneven load distribution, increasing injury risk. For sprinters, explosive movements and quick direction changes put a lot of stress on muscles and tendons, especially if your movement patterns aren't optimal. Also, differences in leg length or joint alignment can cause repetitive stress on certain areas, making injuries more likely to happen again. Health and lifestyle choices influence injury risk as well. Not getting enough sleep or having poor nutrition can impair your body's ability to repair tissues. For example, low vitamin D or calcium levels weaken bones, raising the chance of stress fractures. If you're not eating enough calories to match your activity level, your body might not recover well, leading to recurring pain or injury. Stress from daily life and inadequate recovery strategies can also weaken your resilience, making injuries more likely to come back. Different track and field events have their own injury patterns. Sprinters often deal with hamstring strains, while marathon runners might face medial tibial stress syndrome, also known as shin splints. Jumpers may experience patellar tendinitis or ankle sprains. Knowing these discipline-specific risks helps in tailoring prevention strategies. To prevent recurring injuries, it's important to manage your training carefully. Avoid sudden jumps in mileage or intensity, and always include rest days. After an injury, follow a proper rehabilitation plan to ensure tissues heal fully. Strengthening muscles and improving flexibility can correct biomechanical issues. Good nutrition, enough sleep, and smart recovery practices support tissue repair. Using discipline-specific exercises, like strengthening hamstrings for sprinters or lower leg muscles for marathon runners, can also help. Regularly checking your movement patterns and addressing any imbalances can make a big difference. In the end, recurring injuries happen because of a mix of past injuries, training mistakes, biomechanical factors, and health habits. Paying attention to these areas and making smart choices can help you stay injury-free and enjoy running for years to come.